We all suffer from the consequences of age, but today, women and men are discovering that by removing excess fat, tightening the underlying muscles, and redraping the skin, a facelift procedure may provide a solution. However, it's important to avoid an operated-on or unnatural look that lets the world know you've had a procedure. Fortunately, the skill and artistry of Dr. Todd C can enable patients to look years younger with improvements which appear natural and virtually undetectable.
This beautiful lady is desiring facial rejuvenation, and we're going to discuss facial examination and facelift procedure. Looking at her hairline here, she has an appropriately positioned hairline, and on her forehead there's no wrinkles. Brow position shows minimal asymmetry. The upper eyelids do show some lax skin and a little bit of fullness. The lower eyelids do have some puffiness and minimal excess skin. Her cheeks here are quite well positioned. The jowls do show some minimal jowling, which the facelift procedure will take care of. Her jawline here and neck has a good contour. There's a little bit of laxity within the neck. And on my facelift procedure, the incisions are all well hidden. The ultimate goal of the results is to make the patient look natural and more beautiful and more youthful. My particular modernized technique that I use not only excises the excess skin, but also tightens up the underlying muscle, thus giving the patient a longer result.
Baggy, droopy eyelids project a tired appearance, often making individuals look older than their age. Here you see examples of Dr. Ci's blepharoplasty procedure. Notice how he is able to have his patients look years younger by eliminating bags and puffiness in the lower eyelids, as well as excess skin and fine wrinkles in the upper eyelids. Many women and men are dissatisfied with the shape and size of their nose. The goal of cosmetic nose surgery, known as rhinoplasty, is to provide harmony and balance, which results in a natural appearance and inspires self-confidence.
With this nice lady, we look at her hairline once again, and the hairline shows it to be moderately elevated but appropriately positioned. I look at the wrinkles in the forehead, which they're minimal. She has had Botox, which has elevated her brows into a natural position. Without that, she might require a brow lift, and that would involve 3 small incisions in the hairline, which would help to lift the entire brow minimally invasively, all hidden scars. The upper eyelids show there's some excess skin on both sides and a little bit of fullness that would be treated with a small incision hidden in the eyelid crease on both sides to get rid of that excess skin and the muscle too, and the fat. On the lower eyelids there's excess skin and some puffiness, which would be treated with a very well hidden incision to treat both the excess fat and skin. On her nose, for patients that do require rhinoplasty surgery, there's many different techniques, and it all depends on the individual. If the patient has too much of a bridge of a nose, that can be taken down and made a smoother nose. If their nose tip is too wide or poorly defined, that can also be taken in and refined to their liking. If the nostrils flare too widely, that also can be brought in. All this can be done with hidden scars, excellent techniques, long-term results.
I was so pleased with the outcome of my breast surgery, I decided to come back to Dr. C and discuss options to have my nose done. I had never been pleased with the look of my nose. I had very large nostrils and no bridge. I work as an accountant in front of people all day, so I was really self-conscious about the appearance, about my appearance. So we discussed the options and planned the surgery. After my recovery and once the healing took place, I was very pleased with the outcome of my nose. I'm no longer self-conscious.
I came to Dr. C a few months ago because I felt like I looked tired all the time. My eyelids were drooping. I was having trouble seeing a little bit because I think it was messing up my contact lens. So we talked, and I decided that I would go ahead and have eyelid surgery and a brow lift. I went ahead and did that surgery. I had no complications, not a minimal amount of pain, some bruising which faded in a few weeks, and I've just been so pleased with the results and very, very comfortable with Dr. C. He makes me feel at ease, and he listens to any concerns that I have. And I've just been very pleased with what I did.
Certified by the American Board of Plastic Surgery, Dr. Rao is known for his emphasis on patient safety. As a board-certified plastic surgeon, he operates in state-of-the-art facilities, which meet Plastic Surgery Society requirements by having quadruple ASF accreditation.